Good afternoon. Scott Hyde joining you once again. Another edition of Tips for Better Hearing from Beltone Hearing Center in Abbotsford. So today we'd like to talk about the ear, the anatomy, how it sort of works, and also the hearing test and what comes of that. So the ear really has three parts. There's the outer ear, the middle ear, and then the inner ear. So the outer ear, of course, includes the visible part and the canal itself. That leads to the eardrum. On the other side of your eardrum is the second part of your ear called the middle ear. That contains these three tiny little bones, and they make a bridge across that middle part of your ear to the third part, your inner ear. The middle part of your ear is linked to your throat and sinus area through this little tube called a eustachian tube. So the third part of the ear is the inner ear. That's a cavity inside the skull. It's filled with fluid and lined with little hair cells. These hair cells respond to different frequencies or pitches and essentially sort things out and send that message along a nerve to your brain. So it's a complex system. There's a lot going on in there. A decrease in hearing occurs when sound does not make it through to the inner ear. That's called a conductive hearing loss. Examples of that could be something as simple as wax, problems with the eardrum, fluid buildup in the middle portion of the ear, or even thickening of these little bones in the middle part of the ear, among other things. Another way that we can have decreased hearing is when sound is making it through, it's just not being processed properly by the hair cells at the inner part of the ear. That's referred to as a sensory neural hearing loss. In those cases, there's really a couple of choices. You can live with it, or if you want to hear better, hearing aids can make a difference in most cases. A conductive hearing loss, many times there's a medical correction for it. So when we do a hearing test, we can obviously tell how well you're hearing, but also we can tell if there is any decrease in your hearing, what part of your ear is affected. And so of course, if we find a conductive hearing loss, then a referral will be made to your physician. Hearing tests are simple and painless. They don't take very long, but we will like to be thorough at Beltone. So book your free hearing test today. Again, Beltone Abbotsford, also Beltone in Langley to serve you. So thanks for your time, and we hope you enjoyed this short video. We'll talk to you next time.